Hello everyone. Today we'll be talking about some signs in acute appendicitis. Some of these you might already be knowing and some of these you might not have a knowledge about. So let's start. First sign is the pointing tenderness sign. This is also known as the McBurney's pointing tenderness sign. This is a very simple sign to elicit. We just put a gentle compression, gentle push at the right iliac fossa at the McBurney's point, and the patient starts feeling a sharp pain. This is the point tenderness. Then we have the Blumberg's rebound tenderness. In this sign, as already the name implies, we try to look for rebound tenderness at right iliac fossa. We put gentle compression and suddenly release the compression. On releasing the compression, the patient feels a sharp pain in the right iliac fossa. Then we have the Rovsing sign. This is a sign in which we put a compression in the left iliac fossa, and on putting a compression in the left iliac fossa, patient starts feeling pain in the right iliac fossa. Then we have the Dunphy's sign. This is simply elicited by asking the patient to cough, and the patient starts feeling pain in right iliac fossa on coughing. This is significant of appendicitis. Then we have the obturator sign. How this sign is elicited? Firstly, we ask the patient to lay supine. Then we try to internally rotate the right hip. And if the patient feels pain on doing this maneuver, it is suggestive of appendicitis with a pelvic appendix. Then we have the iliopsoas sign. This sign is elicited by extending the right hip. If the patient feels pain, it is suggestive of appendicitis with a retrocecal appendix. Seventh is the 10 horn sign. If you put a gentle traction of the testis, it creates pain in the right iliac fossa. It is suggestive of appendicitis. Then we have the Aaron sign. A continuous gentle compression in the right iliac fossa causes pain in the epigastrium and the chest region. This is known as the Aaron sign. Then we have the Basler's sign. This is a sign of chronic appendicitis. What we try to do is, we try to compress the appendix between the abdominal wall and the iliacus, and the patient starts feeling a sharp pain, suggesting of chronic appendicitis. Then we have the Elder's sign. This is a very useful sign, especially in pregnancy. What we do is, we maintain a constant pressure in the right iliac fossa at the area of maximum abdominal tenderness, and then the patient is turned to left. If the pain remains constant, it is of extrauterine origin, and if it disappears, it is likely to be uterine or tubal origin. This is a very useful clinical test which should be employed in all cases of acute abdominal pregnancy. Then we have the Bastido's sign. This is an obsolete sign, not used nowadays, but for the academic purpose, you should know what this sign is. It is pain and tenderness in the right iliac fossa when we try to inflate the colon with air. The patient starts feeling pain in the right iliac fossa. This is an obsolete sign, not used, but you should know it. So these were some of the signs that we see in acute appendicitis. Do let me know if I have missed something. Thank you so much.